So just carrying on from the last presentation that I did on portfolio, I'm just going to this time just demonstrate what a typical month would look like. So we went through what all these things on the left were. So I'm going to go back to Dr. Test's dashboard and go to these submissions. Actually, let's go. No, let's start with actually month one. So like I said, you go into here, you click into the modules, there's 6 worth of materials plus resources and learning needs plan. So you go into here. Every month follows a typical format. There are case-based discussion templates. If you go into view, these are all fillable boxes. And what I've done, I've put what you call an additional case-based discussion, additional DOPS, but I've also put in what I really do feel that the first month you should cover as a minimum. So that's a case-based discussion on an adult child. That's an experience checklist just for you to do with your mentor in terms of a clinical experience where you feel you're at and where your confidence sits with these procedures. DOPS is a direct observational procedure, and that I'm saying let's get your mentor to observe your first and new patient. And then there's restorations, observations, amalgam and composite. And then you start to see aspects of your educational clinical support plan starting to kick in. We were already putting those in the induction anyway, but you're going to see more and more as the months go on. This is a typical PDP that they would ask you to complete, and there's a template here for you to be able to do that. And then every month there's a reflection on the month, looking back, and a recommended tutorial section here, and a tutorial template. And then, like we said, a recommended, and then go to the webinar section and complete the recommended webinars for this month, so you can get your CPD on it. Now, Dr. Test has done a lot of things in month one, and now they are showing up as submitted forms. So they did the NHS rules and regs webinar and got 90% in that, which was great. And then they did a tutorial here, they did their reflection, they did an observation, an additional CBD, and then they did the adult one as well. So I probably explained in the previous presentation that there's a flow to each form here. The dentist would complete it, the mentor can then review it in their own time, and then I can also review it and provide some feedback or see how the learning is going on, and if there seems to be a gap, that's where I could help the mentor and the dentist to fill that in. So what does a typical reflection look like? If you go to that, who is it submitted by, the dentist names, the date, what was the learning material, how did you apply it, how are you going to maintain your knowledge, how you continue to develop in this area. Go to the back feature. What does a typical tutorial template look like? If we go to that, the name of the dentist, the topic, the areas that were covered, the actions that came out of that tutorial, the reflection from the dentist on what they learned, what will they do more of and less of, and then the feedback from the mentor as well. That sits into there, and then I would have additional feedback that I can also give. And just to remind you, you can always export, download a PDF copy of that. So if we look at what a reflective statement of the month would look like, again, following very similar themes of what you learnt, how you're going to keep your skills up to date here, and how you're going to apply it. What does a typical observation look like? If you go to view, the description of the encounter, and we look at grading these categories: examination, diagnosis, treatment plan, procedural knowledge, communication, professionalism, and areas that might require some development. Were they acceptable? Were they not? Did you observe this aspect or not within the discussion? And then there's a reflection to be completed by the dentist. These are the competencies. In the observation, sorry, you click, the dentist will complete this, and then this is the development plan that came out of that observation, who observed it, the date, and so on and so forth. Again, so this was an observation, sorry, for not a case-based discussion, this was an observation for a new patient examination. So the mentor observed the dentist on their first encounter, or one of the first ones, of how to do a typical examination. So what else in that month? The CBDs, they follow the same format. So let's just go into the case-based discussion. Now, a lot of the case-based discussions do form the basis of our tutorials, and as would the observations, because I can now see and kind of almost put everything together. It's like pieces of a jigsaw puzzle. I can see what the mentor was doing in practice. I can see the actual feedback that the encounter and the event. I can now talk to you about this, and then put that together and say, let's maybe have a case-based discussion, whether we look at the same notes and see what areas we can improve on that. Were the investigations you did in that case as comprehensive as possible? Were there alternatives you could have done? What kind of treatment plan were you thinking about? So it will get you started on kind of using your clinical reasoning skills now in practice. So it's not just, you know, what you were taught, it's now actually applying it, but having two people to bounce things off, not just your educational supervisor, but also I would be at the other end of this, keeping very close eye on your training. So let's just have a look at what a typical case-based discussion looks like. Again, very similar formats to the observations. Always got a reflection, the criteria that was being assessed, the competencies that were being assessed in that. So we are looking over the 6 months to really look at all of these clinical competencies, and the 6-month portfolio does encourage a range of all of those. So in, this month we're looking at restorations and examinations. In month 2, you'd be looking at starting some endo or dentures, and there'll be case-based and discussions around that. Extractions will also come into that, but they are put in month by month. Just to point out here, it's not that you have to follow month 2 has to follow month 1. You might find that actually in month 2 there was stuff going on about extractions, but you're doing some of those in month 1, so you can jump to month 2 and do that case-based discussion and observation on the extractions. You've now experienced it in your 2nd week. There is no hard or fast rule. It's actually quite flexible, and this is where I feel that this is personalized to you, and you can use it in the way that you feel fit and it's going to fit your learning. So it's not that you have to complete month 1 and only month 2 opens to you. All the months will be available, and you can dip in to whichever now becomes relevant to your particular experience in that day with your patients and your mentor. So yeah, get typical format. You've got the feedback here. Who was the case discussed with? And if you can always have this option here to submit it if you think, oh, I can put that in, let me put that back in. So all those features have been kind of revamped in this portfolio as it's been developing. So if we look at this page here, will continue to grow, and as you submit things, and as I would have to go into my own login here, and I'll be able to see all of your submissions. I will then, this will turn green for me because the mentor's reviewed it, I've reviewed it, and then it will go into this section where it says reviewed submissions, because once everyone's kind of got their hands on that and it's really been ironed out as a learning event, we can now put it into reviewed submissions, and it's always going to be available to you. So I'm hoping that this month one overview, which I've just used an example, they all follow very similar formats. Dental emergency, month two, multiple cavities, bite reg, denture fit. Um, Again, all very similar. Um, so I just to close that off, we will at um, a typical clinical education, educational clinical support plan as well. But I think that is probably saved for the next presentation because I think that's something that we should spend a bit of time looking at. So all of you guys are prepared to know what that plan looks like and how extensive it could potentially be. And then hopefully once you looked at the induction video and you've watched this one and now you've looked at what a plan is looking like, you're getting a general feel for how this all comes together and would make your first year pretty smooth. I hope that helped. Time.